Like, not only do I not trust providers with my body, you want me to trust you with my mind? That's on a whole nother level. Especially when we tell them during our intake session, well, if you disclose that you're gonna harm yourself or someone else, I'm a
Mm-hmm,
mandated
mm-hmm.
reporter. That's gonna scare off a large population of people because I'm supposed to come to you to help. But if I tell you that the help I need is because I want to hurt myself, and you're gonna call the police on me, then I really don't want to talk to you.
Hello, and welcome to the How Are You Really podcast. Our title for today is Roots of Resilience Healing BIPOC Trauma. I'm your host, Dr. Faryal Malik. I'm a child, adolescent, and adult psychiatrist. I am very pleased to welcome our guest speaker today, Sherae Green, a licensed mental health counselor based in Florida. Sherae specializes in working with BIPOC individuals navigating trauma, anxiety, life transitions, and identity development. She is the owner of Healing Roots Therapy, a virtual private practice centered around culturally responsive care, rest, and liberation, and she is the co-owner of Opal Blossom, a business dedicated to wellness retreats and community building for mental health professionals. Sherae is passionate about creating safe, affirming spaces where people, especially those from historically marginalized communities, can reconnect with themselves, heal, and thrive. We're excited to have her here today. Welcome, Sherae. First of all, can you tell us what actually BIPOC means? Because a lot of people are not going to know.
So BIPOC was actually a term that was created to include, because for a long time people were just saying people of color, POC, but there were certain marginalized groups that felt like they weren't included, so they created BIPOC, that stands for Black, Indigenous, People of Color. So that can be Black individuals from the Caribbean, individuals that live in the continent of Africa, it would be people that are Asian, Pacific Islanders, people that are Middle Eastern, all fall under the category of being BIPOC. It is definitely a new term for people to get used to.
Yeah. Well, I'm so glad that you're here and you're going to talk about this topic because it's so important and we need to create more space for this topic to be discussed. So I'm going to ask you about the history of trauma and intergenerational trauma that have impacted the BIPOC communities.
Yes. So, especially when we're talking about individuals like Black individuals, trauma essentially started from our existence, right? When we talk about the Atlantic slave trade, we talk about Native Americans, and when Christopher Columbus came over and wiped out a lot of native tribes and things of that nature, our existence started out with being traumatized. We were shunned for who we were, for how we looked, for how we behaved, and being labeled as barbaric. I will never forget in undergrad, when I went to Howard University, one of the books that they assigned us to read, I was so mad when it said that one of the reasons that they created the slave trade is because they viewed what Black individuals in the continent of Africa were doing as barbaric, but stealing people from their country and raping individuals, things of that nature, wasn't considered barbaric. But people just living off the land and just being happy, having community and things of that nature was considered barbaric. So as things progress, we've learned, especially through research, that we don't even have to directly have been impacted by that traumatic event of slavery, like things like the Holocaust or things that happened to communities. Just being a part of that lineage held onto the trauma in our body. And so, like, I remember in grad school, one of my professors talked about how she knew generational trauma was real because she noticed that there was this particular scent that bothered her, and she never understood why that scent bothered her. And she was talking to her mother one day. I don't know why I get like this really bad response from this scent. I mean, crying and all that. And then she talked to her grandmother, and turns out her grandmother had experienced a traumatic event,
Mm-hmm.
and that scent was present during the time that her grandmother experienced what she experienced. So that as the lineage proceeded on, everyone in that lineage had an adversive reaction to that particular scent. So it just shows how no matter how far away an experience has occurred, if we don't do the work that we need to do to be able to process whatever had occurred and what have you, then it's still going to move on through our generations, through our offspring, to our children, and things of that nature.
Yeah, going back to the history of like slavery, it goes back to even before like America, right?
Uh-huh.
Like, the slave trades and being Muslim, I've read about this. Even the Quran says that there is no difference between white or black, that
Hmm.
they're equal. And I never understood why it says from 1400s, right? But slavery was then a thing too. And racism and colorism was a thing back then too. It's incredible how many generations and how many centuries this trauma has lasted,
Uh-huh.
and how long we're carrying the trauma for.
Not only are we carrying it, things that occurred in those instances have just been redone, put a new face and put a new label to it, but it's not that much different than what had occurred in the past. When we talk about like the school to prison pipeline, when we talk about mass incarceration, those are still slavery,
Right,
just
right,
with a
right.
different name. We just
Yes.
rewrote it to make it not sound as bad, but it's just modern day versions of it that have now been legalized and written into law that affects a lot of brown and black communities till this day, in terms of like also traumatizing the household. Looking at how mass incarceration affects fathers not being in the household, affects mothers not being in the household, having CPS and things of that nature being integrated into people's families. And then there's this lifelong thing of always having to be going through these traumatic responses. And regardless, I still got to push through because bills got to get paid and things of that nature, never having the moment to like actually process what went on in your lived experience.
Yeah. Hello. This podcast is being sponsored by FMP Mental Health Spa and Family Psychiatry. If you need help, please reach out to us via our website or email or call us. We are available in Tampa, Florida in person, as well as via telepsychiatry in the states of Florida, Georgia, Kentucky, Virginia, and now Pennsylvania as well. So, can you tell me how trauma can present across different cultures?
So, from what I've noticed from working with individuals that have experienced trauma, especially in BIPOC communities, we don't get the moment to sit down and sit in our feelings and process what we went through and things of that nature. Like I said a few seconds ago, we still have bills to pay, we got work to go to, we got children to take care of. We're taught, one, not to feel our emotions, or we certain things we push under the rug. We don't talk about it. These are shunned topics. You shouldn't bring it up. We want to put on this facade like everything is good, while internally we're going through turmoil. Like statistically, it shows that brown and black people, when they have depression and anxiety, that usually manifests in frustration and anger. And then we get labeled with these different titles of being like an angry black woman, angry black man, when in reality there's a lot that these individuals have went through, and the only way they know how to let it out or express themselves is with frustration. They weren't taught how to cry. They weren't taught how to meditate and do all this other stuff. In our household, that was labeled as white activities. So these are things that we go through.
Yeah.
It
Yeah.
it manifests in other ways where we're arguing with our partners and things of that nature, not knowing where the root of the issue is, or when we do sometimes know what the root of the issue is, but we don't know how to address it. Most people don't wake up and be like, okay, I know this is the traumatic event I went through, and then this is how I'm supposed to go to therapy. Therapy is not accessible to most brown and black people. Insurance may cover, but they may have a high out of pocket expense that they have to pay. Like, it just manifests in so many ways, affecting work, affecting interpersonal relationships, how you view yourself just in society, especially when we're talking about more specific traumas like racial trauma. That affects how you move in society, having to code switch and put on this certain persona so that you're accepted in the Western world and things of that nature.
Yeah. And what do you think, even if it is made accessible, which, now there is a effort to make these services accessible, right? What holds BIPOC communities back? Like, is it stigma, and why is that stigma there?
I think it's multiple factors. Definitely stigma. A lot of clients to this day that come to me and they're like, I don't know what I'm supposed to do here. Like, how does this work? Does this actually help people? And I'm like, yeah, if you meet me halfway, like, I can't do the work for you. Stigma, also finances. Like, yeah, you may have insurance, but if your out of pocket cost per session is $60, that's a lot of money to have to pay. And it's like, do I pay my phone bill? Do I put gas in my car? Do I work on my trauma? What's more important in the moment? Like when we look at things like Maslow's hierarchy of needs, if your fundamental needs aren't met, how are you supposed to process trauma? That's the last on the totem pole. We're not thinking about things like that when the lights may get cut off or you need to put food on the table, especially in this economy. Another factor of why black and brown communities struggle with going into therapy is there's just not a lot of brown providers. There are not a lot of black providers. It's hard to find someone that you know and can trust. Everyone now wants, like, a lot of people want black or Muslim or Asian providers that look like them, but we only make up a small percentage of the mental health field. I know specifically for black therapists, we only make up 3 to 5% of the mental health field. And I think overall with BIPOC is maybe like 7%. That's nothing when there's so many immigrants and things of that nature that live in this country. How do you know that they can really understand you? I've had numerous clients come to me and like, oh, I tell them about this, but they want me to stop talking to my family. That's crazy in some community. Like, you can't tell to stop talking to them. Like, that's going completely against the fabric of their cultural identity. So in order to like help in those aspects, white providers still should be able to provide a service to black and brown communities, but learning that it's not about you, especially when you walked your whole life with you being the priority as a white individual. Learning these individuals are coming to therapy that don't look like you. They need to be able to tell their own story. You take a back seat, and being culturally competent is so important. We talk about being culturally competent, but what does that actually look like?
Yep.
I feel like a lot of people label themselves as that, but if you're using CBT and telling a client how to use certain boundaries, that's going to completely disrupt their whole identity, are you really culturally competent?
Yeah. So one of the things you brought up was that a lot of providers don't look like us brown and black people, right? So why is there a mistrust on a general level? I know one of the things you mentioned, like, they're telling you to do something that doesn't make any sense from the cultural background, but what other reasons are there that there's this mistrust of healthcare systems in the BIPOC community?
History. When we look at Native Americans and they were given blankets with smallpox, there was no doctor they could turn to. There was probably healers there that actually helped with giving them these diseases. When we look at the black community, Tuskegee, oh my goodness, what is her name? With the John Hopkins, where they were taking her DNA and using it for research, but never paid her family any royalties for the research that they created from her DNA. Looking at things like the Holocaust, where they did crazy research and actually like trying to manipulate people's bodies and things. People have a lot of fear and trauma as it relates to providers. I mean, just mental health. Mental health is on a whole nother level. Like, not only do I not trust providers with my body, you want me to trust you with my mind? That's on a whole nother level. And I think even though a lot of these things happen a long time ago, it's still going to take a long time for people to trust that they could talk to us, especially when we tell them during our intake session, well, if you disclose that you're going to harm yourself or someone else, I'm a mandated reporter. That's going to scare off a large population of people because I'm supposed to come to you to help. But if I tell you that the help I need is because I want to hurt myself and you're going to call the police on me, that I really don't want to talk to you. There's so many
Yeah.
barriers when it comes to seeking help that isn't culturally competent.
Yeah. So, let's talk about the masking of trauma responses in different cultures. How have they been doing that, and how do they continue to mask these trauma symptoms and responses?
Let's write it off as humor. Humor makes us feel very comfortable, right? Everything's a joke. Look
Yeah.
at things like Black Twitter. No matter what's popping off in the world, we turn something into a joke.
Yeah.
But we
Yeah.
do that on the personal level as well. Like, oh yeah, I got beat. This happened to me at XYZ, and just making it into a joke as to one build community. Like, oh yeah, that happened to me too. Not
Mm-hmm.
realizing we all experience some level of trauma,
Yeah.
masking it also by just putting a smile on your face.
Yeah.
We traditionally are taught, especially for little boys are supposed to cry.
Yeah.
So
Yeah.
then how are they supposed to then express and process that they went through a traumatic event? No, they're supposed to stand up straight, put their shoulders back,
Mm-hmm.
put a smile on their face, and keep it pushing. And
Mm-hmm.
because at the end of the day, you still got other stuff to worry about. We minimize a lot of our experiences, not realizing how it manifests and affects other areas of our lives,
Mm-hmm.
not just our sleep, not just how we interact with others, our romantic relationships, our relationship with our parents and our families. Like, if there's turmoil in the household,
Mm-hmm.
that's
Mm-hmm.
not normal.
Yeah.
If you can't sleep, that's not normal. You
Yeah.
can't eat appropriately, or that's not normal. That's not how we should be living our life. But we normalized it so much that living in a state of chaos is our normalcy. Especially when you're working through trauma with clients and they realize, "Oh, I wasn't supposed to be experiencing that. Like,
Mm-hmm.
I wasn't supposed to be shutting people out of my life. I wasn't supposed to be turning over in the bed, not being able to fall asleep, can't sleep through the night, having like that's not normal. Everybody don't do that." And then when they finally start to experience, they're like, "Oh, this is what peace looks like. I didn't realize."
Yeah.
And then
Yeah.
they're confused. They're like, "Are you sure this is right?"
Like it's not normal because normal was the chaos. Right. So, what about somatic symptoms that come up from the trauma? Because again, we're masking the other emotional responses or talking about the trauma. So, does it come up in our body? How does it show?
It definitely comes up in our body. We feel a lot of tension in like our neck, in our back, and things of that nature. I have a few clients I worked with that it has turned into actual medical issues because they didn't address these trauma, or even the trauma has caused for their brain to elicit pain in certain areas in
Mm,
relation to the traumatic event. So people that experience like physical abuse, now they have a serious like medical pain in certain areas that if you connect it back to the trauma, that's probably where the abuse impacts may have happened on their body. Our mind, our body, and our spirit are all so connected, and when they're not all treated and given the certain attention that they're needed, it's going to manifest and make things worse when we look at things when we're trying to diagnose stuff, right? We look at how it's affecting other areas of life. If you're in so much pain that you can't go to work, that affects a lot of things. If you have, I've had clients where so many migraines and stuff because they're trying to like suppress like the memories and things. You gotta let this stuff out. If you're causing your body pain because you're trying to suppress stuff so badly, that it's
mm-hmm,
gonna manifest in medical issues.
mm-hmm. Yeah, yeah, absolutely. Okay, so turning gears a little bit, what is the importance of culturally responsive therapy and what happens when it's missing?
It's so important. I always, when I meet a new client, I always start my spiel off with, if the report is not there, if you don't feel comfortable talking to me, we're not going to get the work that needs to be done. Everyone has this big push for therapy right now, and that is great. But I always say you got to date around till you find the right therapist, because this is the one very few place where you're unapologetically and authentically yourself. And
Yep,
if you
yep.
can't be that, that is the wrong therapist for you, because you about to spill all your guts to this person And you need to be able to know that you can trust this information with them. They're going to be able to understand your perspective and the lived experience that you walked in, and then be able to actually help you. Yeah, we could tell people our steps, but if you don't, the person on the receiving end, the therapist, doesn't understand the connections between societal influences, between laws, influences on their life, how generational trauma affects them, you're not going to be able to work on all facets of the individual. It's not just the individual. So, like, if you just came to me, oh, I have nightmares, the nightmares aren't just coming out of nowhere. A true culturally competent therapist is going to look at every aspect of the individual and figuring out the ties to it. And that's being really culturally competent, looking at everything and being able to see, like, it's not just the symptom, there's more to the symptom.
Yeah, yeah. We are trying to get more BIPOC people to become therapists and come into these fields, even doctors, right? There's not enough Black doctors. Like, I go to my annual child and adolescent psychiatry, national meeting, and I see one Black man child psychiatrist there. And so it just breaks my heart. I'm sure there are others, but at that place where we're representing, there's one. There's more Black women, but there's one Black man. And so that is just heartbreaking.
The men,
These are a lot of people. This conference is huge. And so that is heartbreaking. So we need more people to come into the fields and like get in and do this work. But at the same time, since as we are working towards that, what can people that are not marginalized and make the majority of therapists and psychiatrists, how can they learn to become culturally competent? Are there courses? What books can they read? How do they go about becoming more culturally competent?
I don't even like recommending like books or necessarily courses, because I feel like that's a very clinical, in the cookie cutter box of the field, and that doesn't give the true representation of a community. If you really want to learn, go into the community, integrate with the different populations. Because also, as a therapist, you need to look at, who do you surround yourself around? You cannot say you're culturally competent as a white provider and all your friends are white. Where are you learning about these different communities? Why is your surroundings not also mirror the population that you're working with? Because that's the only true way to learn. Like, I learned about Muslims by having Muslim friends, learning about the Quran, learning about all those different things. Same with learning about Judaism. I met Jewish people. They taught me about it. That's the way you learn about the true practices. Everybody can pick up a book, but that doesn't mean you really know the deep nitty gritty of everything. Like, you have to actually involve yourself in the community. Another aspect of it is that, because what happens, because I learned this in my cultural competency class, I don't even remember what the phrase is, but this has always stayed with me, that when any white individual learns about a new community, it is not then your responsibility to then act like you know more than that said community, because you don't. Let the client be the experts in their story. Yes, get educated on it, influence yourself by being in the community, go to certain events, and what do they call it for Native Americans? The powwow. Like, if you want to learn about a Native American community, go to a powwow. But then if you have a Native American client, please don't act like you know more about it than them. Because you don't. Experiencing something once, maybe twice, maybe three times does not make you an expert in said a lived experience. You have knowledge of it, but you are not the expert in it. So anytime I get a South Asian or Pacific Islander client, I'm familiar with these communities, but I always ask, so I know this about it. Am I right? Or is there more that I should know about it? Let them tell you about their experience, and you learn more from that knowledge than just picking up a book or doing a training. That's just not enough. If you're going to do a training, it should be more so on non-traditional therapeutic approaches for working with BIPOC communities. Because if we're honest, majority of these theories that we use in therapy are created by dead old white men. And it does not mirror the BIPOC community. It does not have that cultural competency aspect to it. So learning either how to mold these original theories we taught in school to be appropriate for these communities, or finding newer research that is more appropriate for whatever is going on. Because let's be honest, the field is changing every day. We learn something new about everything. We should all be well informed, especially about the cultural aspects, because that's what molds our client. That's who they are, the fabric of their being. So there's so much to it, but just reading a book isn't enough.
Yeah, yeah. The racial trauma is ongoing, right? And so then there's probably like you said, like turmoil in the home at times. So there's that personal trauma, then there's ongoing racial trauma, and then there's generational trauma. So there's so much like burden on the BIPOC individuals, right? So do you have anything to say about that, and how, what do you think our approach should be in helping individuals with all this burden? There's obviously sometimes people don't even know that they're carrying all this burden, right? And is it better to explore it and let it come out automatically, or should we bring it up? How do we go about it? There's a lot of burden.
I will say that I feel like as BIPOC individuals, we are more self-aware about what affects us than people give us credit to. We just don't know how to fix it. And that's where the therapy component comes in. I think as new clinicians enter the field, and even old clinicians need to learn that we have to reinvent the wheel, especially when it comes to working with BIPOC individuals, because we're taught in school that we shouldn't be as political, we shouldn't be this and be that and what have you, but that's our client's identity. That all those things affect them. So acting like those things are not present in the therapeutic room does them a disservice. Maybe a client's not ready to work on it. So anytime I get a client and I realize that maybe there's some racial trauma that they've experienced, or sexist experiences that they've had in their life that they may not, they have identified but don't realize it's affecting other areas, I'm like, look, so I realize this, but you tell me if you want to work on that or not. It's not my place to say they need to work. I know that it needs to be worked on, but that don't mean you're ready at the moment that I bring that up to you, right? So I always leave the ball in the client's court. Like, you tell me how you want to move, because what I don't want to do is, without their consent, open Pandora's box and for them to realize how much of their life has been affected by so many things that are outside of their control, and then they can't handle those emotions, and that I can't close Pandora's box back. I'm not gonna do that. You tell me when you're ready to move. We will go move together, but I can't, one, act like certain things aren't affecting my client's life. That does them a disservice. And two, letting them decide when they're ready.
Hello, everyone. I just wanted to stop by and ask you, how are you really doing? Also, how are we doing? Are you guys enjoying this topic? Please leave us comments about it. And also, if you have any pressing questions, please go ahead and leave those in the comments too. We will find an expert to come and speak about it. Finally, please subscribe to the channel, like our videos, share it with your friends, and follow us on Instagram. What is the role of community, cultural pride, generational, ancestral resilience in healing?
BIPOC people are some of the most resilient people on the planet, without them giving themselves enough credit sometimes. Like, our resilience is sometimes a trauma response, because we don't, like I said earlier, we don't have the time to sit and wallow in our feelings about, oh, I've experienced XYZ. Society doesn't give us that grace to do that in reality. So we have no choice but to be resilient and keep pushing and getting stuff done. which is a great quality to have. But I feel like a more important quality for us to have is giving ourselves grace to relax, to sit still and take care of ourselves, especially in the BIPOC community. But a lot of the times we're taking care of so many individuals that we neglected ourselves. We're taking care of our parents, taking care of siblings, of children, our partner, that by the time we done filled up everybody else's cup, our cup is empty.
Yeah.
Yeah, we resilient, but what's left for you?
Yeah. Yeah.
When are you going to take care of yourself? Now, that's the
Yeah.
hard part. That shows the real growth when you decided, all right, I've helped all these people. It's my time now. I'm going to prioritize my well-being, my mental health. That doesn't mean you neglect your family, but if you are not secure, how can you help anybody else?
Yeah. All right. So, non-BIPOC therapists, right? Or even some BIPOC therapists. There's some that don't know how to do this, but how can, like, I mean, they just can't, like, they don't even realize.
Be amazing.
Right. So, how can therapists hold space, for BIPOC individuals and their trauma without pathologizing cultural differences? Because there's these cultural differences, right? Even just within the BIPOC community. That's why I was saying that BIPOC therapists don't know at times, and there is cultural differences, but they get sometimes labeled as pathological or negative or something that needs to be let go of. So how can therapists hold space and not do that?
It goes back to integrating yourselves into those communities, because let's just look on the basis of racial, spiritual identity, right? Because that's where a lot of this stuff will come up as being a psychosis, right?
Mm-hmm.
My client is telling me that they're speaking to spirits or what have you. That doesn't mean that they're schizophrenic. If I understand their cultural identity, like if they are an individual, a Black individual from New Orleans, I understand they're gonna be talking to the ancestors and things of that nature. I'm going to respect. I'm not gonna be like, let's put him on psychiatric medication. Like, no, we're not gonna do that. If you truly have an understanding of people's cultural religious backgrounds, then you will understand what's the difference between true psychosis and their cultural identity. And I've heard it time and time again from multiple different providers. They were consulting and they mentioned something and I'm like, that's not what you think it is. They're just spiritual. Everything doesn't have to be a hallucination or a delusion. If that finds them comfort and it's helping, it's not something bad. Like, just because we don't understand, we haven't experienced it, doesn't mean that their reality is not true. That doesn't mean that their reality is the psychosis. If that is what helps them on their healing journey, then so be it. God, I have visions. Okay, tell me about these visions. What they look like? Oh, you talking to God? Okay. Is he helping you out? But that doesn't mean that is then a bad thing. If you understand people's spiritual background, their cultural background, and that is the norm for that, it is not a bad thing. If it helps them through their walk and healing and processing trauma, and that's what is their coping skill essentially, then influence it, help them, understand it, but don't automatically label it with, oh, this is a mental health issue. This is psychosis. They need psychiatric medication. No. Are you actually listening to your client or are you waiting to respond? There's a difference, and the client is going to feel the difference, especially clients feel it when they realize, oh, they don't really understand me. They think I'm crazy. I thought I could talk to them. And then you're surprised when they don't show up. You haven't created this safe space for this person with a different background to truly be themselves, to be unapologetically and authentically themselves. That's them. That's their cultural background. It's going to have influence on how they process trauma, how they process anything that's going through with them. But that doesn't mean that it's then psychosis or this or that. Understand people in their whole, not just the individual issue that they're coming to us with. Because in reality, it's not just that. And we know that.
Thank you so much for that. I want to kind of shift gears back to our title. So, what does Roots of Resilience mean in this context of healing BIPOC trauma?
Roots of resilience for me is that when a client comes to us, the issue that they present us with is not the core issue. When we look at a tree, there's a lot more to these trees than just what is on the surface. And a true good clinician is going to do the investigative work of looking at the roots. There are going to be roots that are centuries years old that the client don't realize is a problem for them. There are going to be roots that are just a couple of months old that started some issues, but they all deal with the base of them, the core of them, and looking at every single issue that can be a problem, whether it's intergenerational trauma, whether it is more recent trauma that affected them, if it's within the household, how their interpersonal relationships are. All those go hand in hand to present with the person that is sitting in front of us. So just because they came to us and say, oh, I'm feeling depressed. Yeah, sometimes depression is solely a misbalance of chemical responses in the brain, but sometimes depression is more than that. Sometimes it's rooted in trauma and years of trauma that we're not addressing. There's more to the individual than what they initially came to us to. That's the purpose of us doing a biopsychosocial.
Yeah.
Learning about different aspects of the individual and how it affects them. Those are the roots of them. That's their story.
Yeah. Okay, so I always ask at the end, how are you really doing?
I'm doing amazing. Honestly, if you would have asked me like 3 months ago, that's so great.
Yeah. All right. That's great. That's wonderful to know. Any parting comments or parting words that you'd like to, give to our audience and listeners?
I always tell my clients that we're not striving for perfection. We're striving for progression. So when you do enter into this healing journey and you're identifying the roots of the issues, giving yourself grace that it's going to be ebbs and flows, especially when we're working through trauma. It's not going to be an epiphany moment every session. It's not going to be, oh, I talked about the trauma this session, now I'm better the next day. It definitely is a progress and a learning progress at that, on seeing how you grow into the new individual of yourself. So giving yourself grace, and also on the provider side, giving yourself grace that things are not progressing as quickly as you would like. This trauma work is hard. It's not easy. Just taking it a day at a time. And when you reflect back, you're going to realize, wow, a lot of work was accomplished.
Thank you. Thank you so much for coming on my podcast and
no problem
providing your insights and educating on the trauma and how we as therapists and healers can help the BIPOC community. And thank you for that. It's such an important topic.
Thank you for having me.
Of course. And thank you to our audience and listeners. Please go ahead and like, subscribe, share, and until next week, thank you. Bye.